98% of women are the ones who suffer with autoimmunity.
I've got a 3-step protocol, the hormone cure.
What do you think that question should be to kind of start them on this healing journey?
How does dysregulation show up for you?
When I'm regulated, I'm much calmer. I can see things much more clearly. What are the 3 areas of health that are most crucial for women's health?
This is huge. I'm going to say number 1.
I'm your host, Sarah Macklin, and I'm on a mission to uncover the maze of health myths around nutrition and well-being and guide you through my 7 pillars of health. Join me on a journey of discovery and connection and pull up a pew for a front row seat to the most exclusive health conversations of our time. Welcome to Live Well, Be Well. One quick ask, please subscribe to this channel. The more subscribers we get, the bigger the guests will be. So many women suffer with symptoms that are ignored or dismissed by conventional medicine, especially women in their late 30s. Navigating our health can feel impossible and confusing. I've personally felt this since I was 15, when I suffered with severe periods and also severe hormonal imbalances. A lack of research in women's health and not knowing where to turn to can lead to serious chronic health conditions. Insomnia, irritability, weight gain, brain fog, these are just a few of a plethora of symptoms that can lead to a decreased quality of life for so many women. Today's guest is here to show us that there is hope and it doesn't need to be that way. The topic of our conversation today is with New York Times bestseller Dr. Sara Gottfried. Her latest book, The Autoimmune Cure, explores how trauma has an impact on our hormones and even autoimmune diseases. The variety and steepness of the hormonal transition in women may be the reason why we suffer more with autoimmune diseases. In fact, 85% of people with autoimmune diseases are women. Sarah joins me today to get into the heart of this topic. My first question for you is, what are the 3 areas of health that are most crucial for women's health?
When I answer a question like this, I want to be careful not to be reductionistic. And the way that I would answer this in my 30s is probably a little bit different than how I would answer it now. I'm going to say, number 1, the way that we feed ourselves. Nutrition is a big part of that, but it's broader than nutrition. It's the way you feed your soul. It's the way you feed your spirit. It's the way that you feed your need to settle your nervous system, your immune system, your endocrine system. So number 1, the way we feed ourselves. Number 2, relationships. From studying men and women and those who are gender non-binary for the past 30 years, I really feel like relationships are critical for women. You know, the idea that the way that people respond to stress is fight, flight, freeze, that came from Harvard in the 1930s. Walter Cannon is the one who discovered this, but he studied men.
Like so much scientific researchers, sadly.
We know women do a lot better when they tend and befriend. And so this relational connection is the way that we respond to stress most effectively. And then third, I would say is purpose and meaning, and really having that sense of a mission that pulls us forward. Those are my top 3. Of course, as I'm talking, I'm thinking about, well, what about heavy weightlifting? I love resistance training. What about sleep? So, there's a lot of pillars, but I think those 3 are the ones that I'm working with the most.
I think it's so beautiful how you describe them, because they do encompass and lean into the sleep and when we want to exercise. Because if we feed ourselves and we nourish ourselves with our soul and our spirit, like you said, not just the food, that's where the sleep and the exercise, I kind of feel, comes in. But the purpose and meaning, I could not agree with you more, because that's something that for me was profound at 23, when I changed my entire direction. And I think that relates so much to the ikigai, which I really believe in, and understanding your purpose and why, what actually brings you happiness and joy, not what you should be doing, is such a big indicator actually of just lowering our stress hormones and feeling a lot of self-compassion for ourselves in that moment as well.
That's right. And I would even take it a step further and say, when you're in that loop of integrity, when you're pulled forward by that feeling of purpose and mission and vision, when you are nourishing yourself at the deepest level, when you're, connected to your girlfriends and other folks who support you, and they're really healthy attachments, that's when your hormones are actually entheogens. So your hormones
Mm.
kind of shift from being just these biological factors to acting like some of the sacred plant medicines in your body. Helping you really create that sense of flow and oneness, kind of universal consciousness. Now I know I sound like I'm from California right now, but I think that your hormones are really critical to to having you feel like you're living your life to the fullest. Like you were just describing some of your time in Chile and in Patagonia. And what I could hear how your body was fueled by entheogens.
Mm-hmm. Mm-hmm.
And that's what we want.
But we don't create an environment, and it's really difficult, I think, to sometimes create those environments. And we go back to our old lives. And to be honest, for context of our listeners, I was in Patagonia for 2 weeks and felt so calm. I was just saying to Sarah before this episode, so relaxed, so unstressed, and just really in balance with myself, which I actually have now realized I definitely struggle with my hormones really badly, but I've always just never addressed them. And that's been the problem because I've not really known to go where to address them or how I address them, or hormone imbalances is such kind of a big term and concept, and if you go to your GP in the UK, it's very hard to kind of get somebody to work with you on a very precise level for you to understand your hormones. So you really either go on the contraceptive pill, or you're put on, I don't know if you've got mood disturbances, SSRIs or antidepressants. And so it's really hard to navigate the landscape of hormones, I feel. And I wanted to know, like, for anyone who's listening to this, and I'm happy to talk about this, I've been through a bit of a transformative week on this exact topic, but how can anyone start to understand if their hormones are dysregulated? Because I started to realize that when I came back, as you said, from Patagonia, and I was really calm. And then all of a sudden, everything just started to increase, my anxiety, my stress, everything. And that's when I started to really realize, how am I feeling hormonally? There's not something wrong with me. I just think actually I might be out of kilter. But many women don't take a moment to stop and reflect on that. So how can people start to understand if they've got a hormonal imbalance? Like, what are the steps to take?
The first step is measurement. So there's a lot of different ways to measure your hormones, but um, what I typically do is when I'm seeing a client for the first time, I'm going to ask them a lot of hormonal questions. So, for instance, with your trip to Patagonia, what I would hypothesize is that when you came back, when you were in Patagonia, your cortisol was probably exactly in the Goldilocks position. So, not too high, not too low. You felt really good. You were in nature. Um, you had this magical trip. And then when you come back to your real life and you've got, kind of the hustle and bustle of living in London, that tends to activate cortisol and dysregulate it. So I would imagine that that was a big part of the story for you. So you could start with cortisol. It's a good place to start. It's the main stress hormone. And what happens with cortisol is that these hormones that we're talking about today, cortisol, estrogen, testosterone, progesterone, oxytocin, it's not a democracy. It's more like a dictatorship, or it can be a dictatorship, where cortisol is the dictator. So cortisol is more powerful than a lot of the other hormones, and it can pull the other hormones offline. So, for instance, when I was in my 30s, I had really high cortisol, and it made my blood sugar dysregulated. It gave me carb cravings. It made it hard for me to sleep at night. It made me feel tired but wired at the same time, like I just had a cup of coffee. And those things led to my progesterone being too low and having this relationship between estrogen and progesterone, which is meant to be like a tango, the tango was off. So low progesterone, high estrogen, it led to fibroids growing, it led to more moodiness. So I think you start with measurement, and that can be questionnaires like I have in my first book, The Hormone Cure.
Mm-hmm.
And then you want to address it. So the way that I like to address it is to start with lifestyle first. I've got a 3-step protocol that I talk about in the same book, The Hormone Cure. And I usually begin with targeted lifestyle changes first. The second step is botanical therapies, which can be really helpful, like with cortisol, things like ashwagandha or rhodiola was really effective for me. And then the third step is bioidentical hormones if those other strategies don't work.
So the 3 steps, the first one with lifestyle, are you talking there more about how you eat, the foods that you're consuming, obviously the caffeine that you're drinking? Like, what are the lifestyle things that you would kind of put in that first bracket, the first kind of go-to protocol?
It depends on the hormone, but with cortisol as an example, there are certain foods that make you raise your cortisol. One is your macronutrient profile. So people who eat lower carb, people who are on a ketogenic diet, tend to have higher cortisol levels. That's something you see typically within 3 days of a lower carb diet. And that's why, and women are really sensitive to that. Some women, when they go low carb, they've got more side effects than men do. They have things like sleep disruption or their thyroid doesn't work quite as well. Food is a big part of it. Caffeine raises cortisol. There can be kind of this chase in between cortisol and sugar, kind of a high cortisol craving sugar. So you want to be careful about that. And then sleep is really critical. So one night of poor sleep leads to more carb cravings the next day, higher cortisol levels. So all of these things are kind of embedded with each other. The other lifestyle changes when it comes to, if we take low progesterone as another example, which is what happens for most women over the age of 35, vitamin C is really critical. So getting about 750 to 1,000 milligrams of vitamin C has been shown to help raise your progesterone level. And so that's an example of a lifestyle factor that could help you with hormone balance.
On this show, you'll hear me talk a lot about the gut microbiome. So I'm sorry if I sound like a broken record, but it is incredibly important for so many elements of our overall health. As a woman in her 30s, I'm becoming increasingly aware of how important our gut health is for our overall hormonal health. Being a woman is never easy, but there is so much that we can do to empower our health and feel comfortable in our bodies. The health of our gut microbiome can impact our serotonin production and our sleep quality. And these are 2 key areas of our mental well-being. And estrogen plays a massive role in the metabolism of our sugar and insulin sensitivity, which keep your gut microbiome regulated as well as your weight. And as estrogen levels start to fluctuate, us women can be left feeling anxious, low in energy, and gaining weight with no logical explanation. But our sex hormones start to decline in our mid to late 30s, and this can cause disruption to our gut health. So investing in your gut health could be the leading preventative factor to help support you through your perimenopause and menopause symptoms. I've got something very exciting for you to try. It is the first probiotic formulated for women going through perimenopause, menopause, and beyond to help tackle the symptoms of the decline in sex hormones and to support overall health and well-being. I'm talking about the Better Gut Daily Probiotic Supplement from Better Menopause. This was developed by a nutritional therapist who was experiencing perimenopause symptoms herself. Our gut health is a central node of our well-being, and women going through this difficult stage in life sometimes need all the support and help that they can get. So if you feel that you've resonated with anything I've said, or you feel that your gut health needs that extra TLC, try the Better Gut Probiotic Supplement for 3 months to see if it helps support your digestion or any of these perimenopause or menopause symptoms that I've just spoken about. So head to bettermenopause.com and use our exclusive code BEWELL to get 25% off your first order.
Well, and you said something there that I've actually got written down on my notes, which is around the age of 35 that your progesterone starts to drop. Why is it? Why is it around the age of 35? And is it something that, I'm actually approaching 35. So for me, that's such like a poignant moment of what you're saying. Because I'm thinking, right, Sarah, tell me everything I need to do to be aware of my hormones, not just falling off the cliff. But it's true, right? Because if I wasn't having these conversations, I wouldn't be aware of that. And I would probably start feeling changes as you did. But obviously you went to such an extreme end of how you felt. But why does it start changing at the age of 35? Like what's going on in the body?
Well, it varies person to person. So, Sarah Ann, you might be the kind of person who doesn't have a decline in progesterone for, who knows, maybe 5, 10 years. On average, you're starting to run out of ripe eggs. So your ovaries don't have the eggs that you had, back in your 20s. And so they just don't produce as much progesterone as they used to. So you run out of ripe eggs, you've got less progesterone. You might have some months where you have, the perfect egg and the perfect level of progesterone, but then you might have a couple of months where your cycle is with a lower progesterone level. And what might show up as a consequence of that is more anxiety, more difficulty soothing yourself. You might notice that you've got some fluid retention. So, those are examples of symptoms of hormone imbalance. And then the other thing, of course, is that you can do laboratory testing to look at these labs. The thing that's curious, and I wonder if this is true in the UK, in the US, most doctors will say, if you ask for a hormone test, they'll say, oh, your hormones vary too much. It's too unreliable. It's not worth measuring. And so people get told that, they get dismissed. And yet, if you're trying to get pregnant and it's not working, and maybe you're 33 and it's been a year that you've been trying to get pregnant, they'll measure every hormone. They'll look at your thyroid, they'll look at your cortisol, your estrogen, your testosterone, your progesterone, your DHEA. So to me, that's a double standard. We've got to change that approach. It can't be that in one situation, hormones are reliable, and then if you're not trying to get pregnant, they're not reliable. They are reliable. Measure them.
Don't you just think that this whole way of how women's health is set up, this is kind of something that came to light for me last week, is there is so much emphasis on a woman when she's pregnant. These 9 months, and it's amazing. There is so much care, there's so much resilience around the woman, taking care of her, making sure she's okay, constant hospital appointments. But before she's pregnant and after she's pregnant, the rest of a woman's lifespan's just not looked at. It's just
Totally.
completely dismissed. And it just seems to be that one area of pregnancy. And it's exactly what you were saying about the woman's hormones. When you want to try for a baby and you can't get pregnant, that's when all the tests are run. But you're meant to live with a hormonal imbalance absolutely fine before then, but you're probably suffering day to day in your general life. And I think that's such a problem that so many women just don't talk about from stigma.
It's a problem. I would say, why are we putting up with this? Like, why are we allowing this to happen? Why?
This podcast is trying to get it out there, Sarah. This is exactly what we're doing.
Yeah. I mean, why is it that women are mostly ignored until they're trying to get pregnant or they are pregnant, and then they go back to being ignored again afterwards? It's like you get your 6-week checkup after you have your baby and suddenly you have no health needs. That's not true. That's not true. So we have to change that.
And so when we're looking at, so you just mentioned a variety of things. And what I really want to take from the first part of this conversation is that we can do things, right? This is reversible. If we have really high cortisol, we can reverse that. It's not going to be there. It's not damaged you forever. If you've got low progesterone, which, by the way, I think I had, so I've had tests done recently after a recent conversation, and that was really, for me, emotional, because for the first time I felt like I had an answer and I wasn't a little bit crazy, and that can give so much relief. And so I think let's talk about, if people are suffering these kind of high impacts of stress or cortisol or low progesterone or estrogen or all of them, or even going into perimenopause, because this is when also all of these hormonal challenges really, really do start. What would be your first step if someone's gone to a doctor and they've been dismissed? They've done the lifestyle changes. They're doing these kind of small different increments that you spoke about, but what's really the next step for them? What testing should they be getting?
Well, this is where sometimes you have to take your health in your own hands. And it's a critical moment to emphasize, because I think within a insurance-based system or more socialized medicine, there's a way that we outsource our power to the people that are in charge of the healthcare system. And that's what needs to change. We need to change that bottom up. It's probably not going to change top down. We have to change it amongst our own ranks. So what do? That's where you can do some direct testing. You can do some home testing. I'm less familiar with how you do that in the UK, so maybe we could riff a little bit on that. But what I typically, in the United States, you can run a number of hormone panels. There's a couple of labs that I can mention that do this directly. So you don't need a clinician to order the tests. And it comes with interpretation so that you can get into action with some of the things that we're talking about. You could certainly do that, read the hormone cure, and be able to, have a sense of a strategy for how to deal with most hormone imbalances. There's also, I like dried urine testing. So, dried urine testing is a little more comprehensive. It tells us not just the level of hormones, but also some of the other metabolic pathways, like how, it's not just that you make estrogen and then you use it and it's gone. That's how it's supposed to be used. But estrogen actually converts into three other types of estrogen. Estradiol, the main estrogen that a woman makes during reproductive years. And some of them are protective. They help to reduce your risk of things like breast and endometrial cancer. But some are more dangerous and risky and can lead to DNA damage and mutations. So, dried urine testing can give you comprehensive information about the pathways of hormones in your body. You can also just if your doctor is not willing to do blood testing, serum testing, you can also look for a new doctor. Find someone, find a woman GP who's in perimenopause. That is your most sympathetic audience right there.
Go to the target audience.
Exactly. Find her.
Yeah, I think that's actually great advice. I do believe that, though. I don't think we've ever said that on the podcast, but if you're not getting the response from the doctor or the clinician you're seeing, seek some other advice. Don't just kind of take that as, well, that's how I'm going to put up with that. And I think that's so important, because if you still feel that you're not being heard, do something about it. I think it's really, really, really important.
Well, it's part of this dismissal, and we don't want to participate in the dismissal. So, going back to this question, why are we putting up with this? Yeah, if they want to order the test, find someone collaborative. Find someone who's going to be a partner with you in this process, who cares about your hormones and wants to get them back into balance again.
Sara, I'm so sorry to cut in, but since Live Well, Be Well is all about health and well-being, I need to tell you what great mental shape I'm in today.
Since we started producing this podcast, it seems that you've been on quite a health journey. And seeing you blossom honestly fills me with joy.
My sleep cycle's on point. My gut microbiome is in better shape than ever. I'm even doing HIIT workouts. Can you believe it? But the reason I rudely interrupted this interview is to tell you about the adaptogenic coffee that you've suggested to me earlier this week, which contains lion's mane mushroom and rhodiola. Two things I personally don't know much about. Perhaps you can enlighten me.
Science shows that lion's mane mushroom is known to improve memory, mental clarity, concentration, and overall just your brain health. And rhodiola is a powerful adaptogen known for its effects on stress levels and brain functioning.
Okay, that's all sounding very exciting indeed, and I can confirm these shroomy coffees are absolutely delicious, and they come in these single sachets, which is incredibly convenient. But I don't really understand what makes them so special, so what exactly is adaptogenic coffee?
The medicinal mushrooms and coffee are probably one of the most perfect pairings. You get all the benefits of regular coffee, which we do love, whilst minimizing any side effects. So why does this happen? I know you're going to ask. Caffeine is a nootropic. It increases our alertness and our attention. But many of us will have experienced the increased levels of the stress hormone cortisol, which results in, sadly, the jitters and anxiety.
This has 100% worked wonders for me this week. So where can people get them?
Okay, so if you want to try these at home, we have a special discount code from the amazing brand London Nootropics, and they have 3 different blends to choose from. So listen up, Sam. Here is your mix. You can have Zen. It's probably the most balancing. It's great if you're caffeine sensitive. Then you've got Mojo.
This is perfect for that natural boost. If you're feeling a bit fatigued, it makes a really good pre-workout because of the cordyceps and also, get this, the Siberian ginseng. And my favourite, to experience the effects of lion's mane and rhodiola, get yourself some of the Flow Blend.
We've got a bit of a treat for the listeners, right? A discount code?
Yes, we do, Sam. And I know that you love it because you love a discount. So all you need to do is use the code LiveWellBeWell to get 20% off at londonneutropics.com. A box of each blend is only £15, so you're kind of getting a very good deal here. And subscription starts at £12 a month, delivered straight to your door. This is something that is so important because when we go into the deeper level of not just blood testing and not just our lifestyle conditions and maybe some herbs that can help with hormonal imbalances and looking at our relationships and all of those type of things, something that I found really fascinating, and it's obviously kind of linked to so much of the work that you're doing now, is trauma. And that feels like a really big, scary word for a lot of people. A lot of people might not resonate to me saying that word, but they should, because it doesn't have to be a huge, impactful trauma event to have something traumatizing happen to you. But how this can also affect the endocrine system and your hormone system. And I think that's something that we can't see, but it's there. So can you talk to me about how it's not just these lifestyle factors that can affect our hormones, it's also something much deeper. Can you explain to us, like, how does this happen?
I've been taking care of men and women for about 30 years. And the people who get better and then they backslide a little bit, and then they, 2 steps forward, 1 step back, or they don't get better, those are often the people who've got a significant trauma signature in their body. So I've really increased my awareness of this. I've looked at it in my own system. I look at it in the system of all of the clients that I take care of. And I think in terms of the mechanism, which is what you're asking, the network in the body that's most sensitive to toxic stress or trauma is the pine system. So that's the psycho, immuno, neuroendocrine system. And we know that the typical picture is that they've got this intense amount of stress related to the trauma that they experience. And then it lives on in their body. It affects their hormone levels, it affects their cortisol. What typically happens, and this was initially found by Rachel Yehuda, is that you may have a period of high cortisol and more stress, and then there's a period of low cortisol, kind of a more burnout picture. So that's how your hormones get dysregulated. And then, as I mentioned, it's not a democracy, it's dictatorship. So once cortisol is dysregulated, that can lead to dysregulation of other hormones like progesterone, like testosterone, estrogen, DHEA. So the whole sex hormone tree starts to get affected. And then your nervous system, you might be someone who, I like to measure heart rate variability. I use a ring to measure it. Yes. And so we're looking at the balance between the sympathetic nervous system, the on button for the autonomic nervous system, and the parasympathetic nervous system. So sympathetic is fight, flight, freeze, fawn. The fawn is something we see more in women, kind of the people pleasing. And then the off button, the parasympathetic side, is rest and digest, kind of classically. I think of it as stay and play, like being willing to stay and play. And so you want this balance between the two. And what happens with trauma is that you might be in sympathetic overdrive, kind of not taking deep breaths, having this feeling of being so wired and like revved up, and not hanging out in your parasympathetic side, which, Sarah, is the place of healing. That's where the healing occurs. It's in the parasympathetic side, like you were in Chile, in Patagonia. It's not the sympathetic side. That does not heal you.
I think, like you mentioned in your book, and as you're describing this, I remember this line where you said that for preparation for your new book, which is The Autoimmune State, which is here, The Autoimmune Cure, but you said you wanted to go and look at what your body felt like regulated versus dysregulated. And I feel like it's really similar to what you're kind of describing there, where you're parasympathetic and your sympathetic nervous system, which I also love. I wrote down stay and play, amazing. But you said the net result was that you were regulated most of the time, and I'm less tolerant of other people and experiences that cause me to dysregulation. I found that so powerful. Can you explain? Because I think a lot of people today are dysregulated, but aren't aware of it. And I feel like it's really similar to what you've just told us in that analogy.
I'm getting a little misty because I appreciate your close read of my words. So thank you for that.
Oh, you're welcome. I found it really powerful.
It sounds like it feels relevant, and that's what I want. I mean, really, the purpose is for us to invite our listeners and our viewers to consider how much dysregulation they have and to really have a felt sense of what it's like to be regulated. So for me, it took, this is more vulnerable. It took going through a divorce a year ago. It took taking on my blood sugar in a way that I hadn't before, because one of the consequences of trauma is that it can disrupt your blood sugar. A lot of people don't make that connection. They think it's just whether they eat oatmeal or have a latte with oat milk, or whether they're eating too much fruit in terms of their blood sugar. And yes, that's important. But trauma also is associated with more glucose metabolism problems, greater risk of diabetes. To be fully regulated, and the way that I measure it is I look at things like heart rate variability. I look at my daytime stress with my Aura ring, and I'm looking for, okay, what are the moments where my body is not stressed, but it's actually restored? And so I really try to amplify that particular feeling. I want to have a felt sense of what that's like. So wearables can provide that information. When I meditate, I've had a meditation practice since I was a kid. When I meditate, I get into a regulated state. The problem for me is that it doesn't last very long, right? So it works for like an hour, maybe a morning, and then whatever, you drive in traffic or, something kind of gets you bent out of shape. Really having a sense of regulation, I think, is critical. And then once you have it, there's no going back. So I'm going to put this back on you. Tell me what it feels like for you to feel regulated. Like, what do you notice?
I absolutely love interviews like this one, which give you so much useful advice for your own life. And if it's helped you, this is an invitation to join my inner circle. It will give you exclusive access to a host of things: expert written articles, nutritious, delicious recipes, your own Members Hub newsletter, Podcast Plus, and also products and discounts decided by me for you. For one very small investment, it will help guide and support your health. If you use the code SAMCommunity, you can get 20% off your Inner Circle membership. Just head to www.saraandmacklin.com.
So when I feel regulated, so I'll tell you that the true story really of my last year. So I definitely suffer with anxiety. And I definitely suffer with lots of perfectionism, and that's just definitely type of my personality. And so I think from my past 10 years where I had chronic habitual burnout and was in hospital, but never realized that, just had lots of different doctors telling me different parts of my body had failed. It wasn't until I obviously went off and studied and realized my full body had shut down on me. And I think I don't really know the off button. And so when I'm regulated, I'm much calmer. I can see things much more clearly. I'm not as emotional. For me, I am a very sensitive person, and something that really stood out in your book to me was, how you describe sensitive children developing more of immune problems, and that really stood out to me. And so I think when people are more maybe highly sensitive, and I don't really like that word because I feel like it's labeling, it's kind of demonizing that you're really sensitive, and I don't think that's a problem at all. I think it's an amazing thing to use your intuition. But I think when I'm more regulated, I just feel a sense of clearness. And I think that's something that when I'm overwhelmed or dysregulated, everything feels quite overwhelming. And I'm sure that sounds like what you were saying. And I love the vulnerability where you said, actually, I'm regulated for about an hour and then I'm dysregulated again. And I feel like, there's this perception that everyone has to be regulated 24/7. And actually, it's just not the case. But figuring out how we can get back into regulation, or what does that even mean, I think is the biggest part of the conversation.
So you talked about the sense of feeling calmer, Your perception is clearer. You you're using your intuition. Like, I think those channels are really wide open. The clarity that you described. And I want to circle back to the sensitivity issue because learning about my own sensitivity has been such a game changer. And I really want to invite our listeners to once again change the paradigm because I'm someone who was always told when I was younger, you're too intense, you're too sensitive, you're too extra, you're too much. Stop being so sensitive, thicken your skin. And so I was told all of those things. And as you described, it's a way of pathologizing sensitivity. Now, there's a range of people in the world. 80% of them are not sensitive. 20% of them are like you and me. We're highly sensitive. We're the ones who tend to go to therapy. We're the ones who are often the seekers. And we go to meditation classes and we learn how to practice yoga. Like, we're the ones who are trying to manage our systems so that we can feel more regulated. The problem is that often the people who are not sensitive pathologize the people who are. And that's what we have to unlearn because, you can think of this, and I wrote about it in the book, that people who are not sensitive are kind of like dandelions. They just thrive anywhere. They don't need, the special circumstances to manage their physiology. And then there's people like us who are like orchids. So we require a certain amount of light, a certain environment, a certain amount of water, a certain, kind of facing north. But once you get the environment that you need and you're an orchid, you bloom and you bloom and you bloom and you bloom. And so that's what we're looking for. We're looking for that environment that is most supportive for your physiology.
And how do you do that? Do you do it to meditate? Is that how you get into regulation? Or is there any other things that you do to basically feel regulated? Because I get a lot from touch. So mine's a lot around touch and sensory is a lot of the way that I can calm my nervous system. And also being in nature. As soon as I see like the landscape open up and I'm surrounded by greenery, I'm calm. And I'm trying to think for people to feel more regulated, what do you advise that they can do to kind of activate this?
What I advise is to come up with a menu. So you've got a few things on your a la carte menu, and I love them. So touch, nature, those are critical. Those are well proven to help people regulate. So I would take it a few steps further. So touch certainly is one for me. But it's not just any touch. It's not like a massage with someone who's kind of unconscious. It has to be a particular type of touch, the touch of a loved one, the lingering hug of someone that I adore. It's a particular type of touch. I would also add orgasm. Orgasm is incredibly regulating, especially for the female body. We are designed for orgasm. We are designed for pleasure. I would put pleasure there more broadly because it doesn't have to just be sexual. And then with nature, I would maybe codify it a little bit more. So for me, and maybe we could do that with your experience of nature. I was just in Japan, and 67% of the landmass is covered by forest. So a lot of the original data on forest bathing and how that helps your cortisol was done in Japan. And I can feel that. I can go to the bamboo forest in Kyoto and I can feel my cortisol settling down. You might want to get super specific. For me, it's forests. It's also, I grew up in Alaska, so having, kind of a span of rugged mountains and letting my eyes trace the edge of the mountains, getting filled with awe and grandeur is really powerful for me. And then I would also say food is regulating, sleep is regulating, relationships, mission, all of those things are regulating when they're kept in the right container and we're not over functioning because that's what tends to dysregulate us. And then I would also say that another really critical piece is getting the right dose of it. getting the right dose of it. So what I see with a lot of women who are in their 30s and 40s and even 50s and 60s is that they give themselves these teeny little doses of things that regulate themselves. Maybe they do 10 minutes of meditation, which is great. Fabulous. We want to take these baby steps toward transformation, but they're not getting the full dose. They're not getting, the hours of hiking in Patagonia like you just did. They're not getting the snowboarding in Niseko that I just got. So, one other thing that I found to be so regulating is plant medicines, psychedelic medicines. So I wrote about that quite a bit in my new book, The Autoimmune Cure, because nothing works like psychedelic medicine to help resolve trauma.
Let's talk about that, because I don't know if you know his work, Professor David Nutt. He got fired from the government in 2009 by saying that ecstasy was less dangerous than horse riding. And he's kind of pioneered a lot of psychedelic research. And
I like him already.
He's fascinating. And I feel like you guys need to connect. I will connect you. But he really opened my eyes to this kind of field. And he does a lot with drug science. We set up a foundation. He does a lot with anorexia nervosa. He does a lot with addiction. And all of this is done through psychedelic treatment. When I read your book, there was so much that jumped out, Sarah, from the fact that 85% of women are the ones who suffer with autoimmune conditions, how this is all kind of entangled up with trauma and unresolved healing, and the Pine Network, which you spoke about, which is hyper dysregulated. And, as I'm reading this, I'm just thinking, gosh, there is so much in here that we're just never taught about, because our bodies are basically treated very separately, not kind of in one holistic manual, should I say. And then you kind of come on to these therapies, which for some people might sound quite scary, but I'd love for you to talk us through, like, how can psychedelic treatment help with this unlock of trauma? Because some of us might not even be conscious that we're holding on to this. I think that's such a critical point to make.
That's true. So I would say the first step is to measure your trauma. Just like we talked about measuring your hormones and doing a questionnaire, you can do the same thing with trauma. So you can do the adverse childhood experiences questionnaire. That's probably the most validated in terms of looking at trauma before age 18. And then in terms of, in the book, I'm talking about the Pine Network and how to regulate the Pine Network. So there's a chapter on immunomodulators. There's a chapter on food. So ways to eat that are less likely to trigger your immune system and less likely to cause a stress response. And then there's a chapter on psychedelic medicine. So there are classic psychedelics, things like mushrooms, ayahuasca, LSD, and then there are the medicines that we put in this category, such as MDMA, ketamine, that are not classic psychedelics. So MDMA is the most interesting. I like that comment from David Nutt. And I would agree with that. I would say MDMA is less dangerous than drinking alcohol. So randomized trial published in 2021 showing that for people who've got severe post-traumatic stress disorder, they did 2 to 3 treatments with MDMA assisted therapy. And 2/3 of them no longer met criteria for PTSD. This is huge. This is huge. Why is this huge? Because we know that if you get the standard of care for post-traumatic stress disorder, which is talk therapy, sometimes trauma-informed, together with selective serotonin reuptake inhibitors, that the benefit, the efficacy is somewhere around 30%. It's abysmal. If I had known that about the therapy that I did in my 20s, I don't know that I would have done it.
And maybe why people give up. It may be why people give up, right?
I mean, it's so expensive. It takes so much time. It takes, some people are in therapy for decades and they're not getting better. And what we know is that the part of the brain that is involved in understanding trauma is different than the part of the brain that's involved in resolving trauma. So you can't think your way into resolving the trauma.
So that's the part of the brain. So that's why it's working, because what part of the brain is it activating?
The brainstem is involved. And this is newer research. So the cerebellum and the brainstem are involved. There's some other parts of the brain that are a little more complex that are involved in trauma. But it's, I think, understanding your trauma, knowing why your mother did what she did or your uncle did what he did, like that's not going to help you heal. So we need a different strategy. And we know that MDMA assisted therapy is more than twice as effective as the standard of care. And then we had a new randomized trial that was published, another phase 3, in a more diverse patient population. So more than 50% non-white people who had moderate to severe PTSD. They got MDMA assisted therapy, and 71% of them resolved their symptoms. So this is incredibly effective. We expect that MDMA is going to get FDA approved in the United States sometime in the next year. And it's coming. So we need to know how to use it. It's very effective in terms of regulating the trauma signature in the body. And is that the case for people who have, I don't have post-traumatic stress disorder, but I've got subthreshold partial PTSD. And so MDMA assisted therapy is really effective for me. So there's lots of different indications. As you described, there's studies looking at some of these medications like ketamine for eating disorders, using psilocybin mushrooms for depression and for end of life and for alcohol use disorder. So there's lots of different ways that these medications will be used. But what I get excited about is how regulating they are. And I can tell you with each journey I've done, and I'm happy to talk about my experiences over the past 5 years. I mean, first, let me say, I was such a square. It wasn't until I turned 50 that I started to see this data on trauma. And I was like, oh my gosh, if you can resolve trauma, we have to do that. We have to do that by whatever means necessary. So that's when I did my first MDMA assisted therapy with a psychologist. I think the therapy part is really critical. We're not talking about recreational use of these medicines. And I can tell you, my heart rate variability doubled in the 2 weeks afterwards. My blood sugar was better. My sleep was improved. There's this initial 1 to 2 day autonomic effect where your sympathetic nervous system is more activated. But then after that, I was in a state of regulation that I can demonstrate with my Oura ring. And that's what we want. We want to have that kind of specificity to show that, okay, here I am dysregulated again. And these treatments, whether it's meditation or some other healing state of consciousness, like using sacred plants, this is the effect of it. This is how it regulates me. And not everyone needs those. I mean, there's so many different ways to regulate yourself. It doesn't mean that everybody needs to take psychedelic medicine, but it's increasingly going to be an option in the 5 to 10 years to come.
I think it's just so fascinating, and also just to hear about, your journey of doing it 5 times, because at the moment, especially in the UK, it's not regulated. So it's really hard to know, how can I seek this? How can I do this in a way that is therapeutic, is what you said? Because at the moment, people are really listening to MDMA and just thinking recreational drugs. But actually, it's a completely different experience when you're doing it with a psychotherapist in a therapeutic setting. But you touch upon all the different therapies in your book, which I found really fascinating. But you also touched upon something else that is really close to my heart, and I'd never spoke about on this podcast before. But it was a lot about the energetic body. Okay, and I feel like this will probably pull into some of the work as well that comes up through psychedelic treatment. But chakras, auras, meridians, all of these things, I felt I kind of got pulled into the direction when I was about 21, and then went into kind of the medical community and thought, right, I cannot believe in this anymore because nobody's going to believe me and everyone's going to think I'm a bit woo-woo. But so on the side, it's kind of been part of my life. And when I read your book, I resonated with it so much. And I loved that you spoke about this with just so much authenticity and power behind it, because I think it's such an untouched area. And this whole like spirituality that people say like this does now have scientific evidence behind it. And I think it's so important. So I just really want you to kind of talk to me a little bit about, you know, the energetic body and how we can come more aligned with that, because I guess this is such a big part of the healing process.
It is a huge part of the healing process. Yeah, subtle energetic anatomy has been known for thousands of years. You know, I first learned about it when I did a yoga teacher training, and you learn about the chakras, you learn about these ways of managing energy and also seeing energy in your clients who come to yoga class. And, you know, you can kind of tell there's certain patterns that you can see with subtle energy. So you develop this sensitivity when you are doing this type of work, like becoming a yoga teacher. I also have practiced integrative medicine since 1994. Oh my God, it's 30 years. So for 30 years, I've been paying attention to traditional Chinese medicine, to Ayurveda, to these ways of working with the body that are a little bit different than, you know, kind of the standard issue medical approach. But I learned that at Harvard Medical School. So at Harvard Medical School, which you would think of as conventional, I took a month-long intensive on integrative medicine where we were learning about acupuncture, we were learning about chiropractic, we were learning about energy medicine, and there was a value placed on subtle energetic anatomy. So if we can place value on that at Harvard Medical School, we can do it outside of Harvard Medical School. And, you know, what I find is that there's a particular pattern with a lot of my clients that I take care of. And I mostly, at this point, take care of executives and professional athletes and also some, you know, kind of salt of the earth people, a lot of hormonal women who feel they have hormonal imbalances. And what I know is that I'm sensing their subtle energetic anatomy all the time. And there's a tendency in our culture to be hypercognitive. So to especially if you've got trauma, like I do,
Disconnect.
You disconnect. So you go upstairs, you try to solve all the problems up here, you don't try to solve the problems in your body. And that leads to, you know, it's similar to how talk therapy doesn't work very well for resolving trauma. So a big part of the work that I do with clients is to feel fully embodied. And that includes an attunement to subtle energetic anatomy. So that's a bit of an overview. I don't know where you want to go further with that, but I'm happy to.
I love this, and I'm hoping my community are going to love this too. There's a lot about, can you talk about the energy through the body? Because you spoke about that just basically shutting off through, and it reminds me of that really famous TED talk where there was, I can't think of his name now, but he talks about, he was a psychologist, and a girl came to him when she was about 10 years of age, and the mother thought she had all these problems, and actually she was just very neurodivergent and loved dancing, and it was a very different way than what she was being taught in school, and that's why she was being so disruptive, and she became one of the biggest ballerinas of all time. And it's so interesting where in the schooling system, we're now being obviously shut off and dysregulated from quite an early age. And so I'd love for you to kind of talk a little bit about kind of the energy flow through the body and how we can start tapping into that a bit more, kind of the flow of the chakras that you mention a lot in your book.
Well, there's specific chakra meditations that you can do. There are ways that you can start to sense into your own system. What I typically do, maybe I'll speak first as a physician and a healthcare worker. So what I learned pretty early on is that when I tune into my chakra system, which is energetically housed next to the spine, and you start at your root, the mula, the first chakra, that's the location of identity. And you know, I'm at a place right now going through a divorce a year ago where I'm shifting my identity. So I can feel a lot of movement that's happening in my first chakra. Your second chakra is related to reproduction, creativity, a lot of your hormonal balance. It's a little bit higher than, if you think about sort of the end of your spine, that's where the first chakra is. Second chakra is right around your pelvis. And what I found as someone who takes care of patients is that, probably related to my sensitivity, my second chakra was wide open. And I would keep it wide open when I was taking care of clients, and it would lead to burnout because I just was letting too much information in and I wasn't using discernment in that process. And so I had to work with the aperture of my second chakra to be able to manage it so that I could let enough information in to help people access their innate healing capacity, but not let so much in that it would burn me out. So these are just small examples of ways of working with subtle energetic anatomy, but let me pass the baton to you because you mentioned burnout, and I'm curious how your subtle energetic anatomy was connected to this.
Yeah, I think I was very much completely numb to my body. I was just completely dysregulated. So when my pure habitual burnout, hospitalization for weeks happened, where my body had shut down, I was completely unregulated. I had to have a seizure and have an ambulance pick me up before I recognized that I was ill, because I was on such autopilot. So I had no regulation in my body at all. I had no connection and I had no feelings come up. So no kind of intense emotions would ever arise because I just blocked them off. And now I feel like I've gone on quite a bit of a journey just from my own research and personal journey, where now I'm the other end of the spectrum. And I feel like I've flooded them fully open. And I think that was a really big turning point for me when I lived in New York and I sought some type of sanctuary because it was so intense. And that's why I'm so, not obsessive, but aware of my environment and how much that affects me. And I found this crystal shop and everyone thought I was mad. Everyone. I couldn't talk about it. I was so ashamed. And I've never spoken about it until this podcast. But I walked into the shop and I was in there for 2 hours. And then every Sunday I would just naturally go into the shop. And it was like something was feeding my soul. And that's where I think my awareness around energy and embodiment and all of those things really started. And because I started connecting to something, I started to feel something. And lo and behold, I bought everyone in my family a crystal and everyone thought I was like a witch and completely nuts. And so I feel even mad talking about it now on the show because it has been dismissed. And I'm not sure how you feel about that from the scientific community. It's amazing to hear that you did this at Harvard and parts of this work. But I don't know how you even felt about it, like writing about it and talking about it from the scientific community and how they're kind of the judgment against it.
Well, first, let me say that I'm going to New York tomorrow and I want to know where the crystal shop is.
I'll tell you.
Yeah, writing about it is tricky because I reviewed about 2,500 studies for my book, The Autoimmune Cure, and I'm a scientist. I'm an academic physician. I work at a university. I teach and do research and see patients. And to write about subtle energetic anatomy is a bit edgy. And yet, I'm in a department of integrative medicine and nutritional sciences where the faculty talks amongst themselves and with our staff all the time about subtle energetic anatomy. And we're doing the kind of research that demonstrates the effect of subtle energetic anatomy. I work with the director of research is Andrew Newberg, who's written, I think, 17 books looking at the effects of God on the brain. What happens when you pray? How does the brain change? These are all things that are looking at subtle energetic anatomy and then looking at the functional correlates, like what happens to the brain, what happens to the physiology. So I feel like we're heading in the direction very, very slowly of valuing and validating these approaches. but they've also stood the test of time. I mean, when I talk about traditional Chinese medicine and Ayurveda and how it's been used for 2,500 years, like these are systems that are very effective. If you've got perimenopausal symptoms, I'm going to tell you to go see an acupuncturist because it's really helpful for your nervous system, and then it helps your endocrine system and probably your immune system. I don't know that that's been proven, but we want to be working with this and we want to be thinking not purely physiological because that limits us, especially as women. It limits us and it keeps us in a place of looking for the fix. And that's what I want to caution people about because, like with hormone imbalances, you might say, oh, well, I just want to go see that doctor because it sounds like she knows what she's doing with these hormones. That's when you're outsourcing your power. And so we want to be thinking about the physiology, but more from a place of how do we get into these healing states of consciousness? How do we balance the hormones and also regulate ourselves? And that's where the subtle energetic anatomy becomes so important.
It's so interesting because when I was writing all of the questions for today and the show, everything was so intertwined. And I think that is the bigger picture of it all, right? Because I was thinking, no, that should go there and this question should go here. And no, I'll move this question down here. But I was like, but it's all matched and it's also integrated. And I feel like that is the essence of this conversation. And you mentioned that so beautifully, whereas, even my perception would be, I'll go and see this one doctor for X and see if it will help me. And actually, it's so intertwined. And I think that's one of the biggest things with autoimmunity, which is what you write so much about in this book, is that there's not really much research on that because it's just so complex. And it's so intertwined from other factors. And I do know that when I put your book up on my Instagram, so many women messaged me that suffer with Crohn's and ulcerative colitis that were in hospital and they were saying, I'm on my last legs. Like, I don't know what to do. Does this book help? And I was like, you have to read this book because it's the interconnection that everything is at play. And we're trying to kind of seek one answer. And I think that's the kind of the biggest fundamental kind of takeaway I've got from this is that actually it's not just one thing.
Yeah, you've described it perfectly because these factors that we've talked about for the past hour are all interdependent. They're all interdependent. And so you can't just isolate, which is a very, sort of modern medicine approach to say, oh, let's just take this one molecule and we'll give you a drug to treat that one molecule. Maybe it's serotonin and taking an SSRI. Let's just fix that one thing and hope for the best. And that strategy doesn't work. I mean, if you look at people, for instance, who have depression and they get treated with a drug like Celexa, hopefully I can mention brand names, you have to treat about 7, 8, 9 people for one person to benefit. But when you take this broader and more fluid look at the Pine system, the way that you regulate yourself, the way that we can improve your regulation, getting you the kind of food and nourishment that is less likely to cause autoimmune attack of your normal self tissues, getting the kind of sleep that you need so that, ideally like 2 hours of deep sleep every night so that your gut can really heal because that's where autoimmunity comes from. It comes from the gut. To consider some of these immune modulators, things like DHEA, curcumin, and then also, when appropriate, psychedelic assisted therapy.
So I think one thing that I'd love you to ask our listeners, what one reflective question should every woman, or every man actually, I'm not isolating men, I know a lot of men listen to the show, ask themselves to the start of their health journey? Because I think the reflectiveness, the questioning that we ask ourselves is actually one of the biggest determinants of what we need. So what do you think that question should be that they ask themselves to kind of start them on this healing journey?
The key question is, how does dysregulation show up for you? We've described the way that it shows up for you. I can talk more about how it shows up for me. I talked about blood sugar and heart rate variability and sleep and things like that. But the question is, we have to personalize this. How does it show up for you? You get into a fight with someone you love. What happens to your physiology? What do you know about that? Can you do some testing to document it? Because once you measure it, then you can improve it and you can get to this place that we're talking about, which is when you shift from being dysregulated to being regulated, there's no going back. There's a way that you know this sense of peace and calm and awe in your body, and you have no tolerance for going back to a state of dysregulation.
I'd really encourage so many people to do that because I think it's just not spoken about enough. I think it was one of the biggest questions that I had from today. And I just think from your personal journey of what I read in the book really touched me on the dysregulation and your whole process to this book. So I'd highly encourage a lot of people to read this and just question themselves. That's a really big kind of health journey start, I think, for me on what I try to talk about on the show. Is it's very personalized and it's very individual. And so what I've explained and what you've explained will be so different to what someone else is listening on the show at the moment. And I think that's so key. But Sara, I've absolutely loved today. I want to hear all about the panel tomorrow in New York on personalized medicine. I want you to send me all the papers on chakra and energetic body. I really want to delve into the research. And I always ask my guests one final question before they leave the show. And that is, what does live well, be well mean to you?
Live well, be well is a state of utter regulation, a state of just feeling like you're living your life at your fullest, that your physiology is at your back. It's like the wind at your back. Like you can do anything that you set your mind and your heart to. So for me, it's all about regulation.
I love that. I absolutely love that because that was such a key theme that I picked up from you and your book, and I feel that you completely body it, which is amazing. Well, I'm going to actually just show this to anyone who's on YouTube. Please go and buy the Autoimmune Cure, especially women. I still can't get over that percentage. 98% of women are the ones who suffer with autoimmunity. And just from listening to your conversation, it makes so much more sense as to why, which I think is a big blanket question over autoimmune diseases. So yeah, I please encourage everyone to go and buy this. And Sara, we'd love to have you back on the show. And
yes,
if I'm ever in the States, I'm going to come over for a cup of coffee and record it there.
That sounds great. Let's do it.
Amazing. Thank you so much, Sara. And yeah, we can't wait to have you back on.
Thank you. Pleasure.